Hello everyone, today I will be talking about deworming in children. Now what is deworming? Deworming is a medicine which is given to kill stomach and intestinal worms. It is commonly asked by parents that does my child have worms? So what are the symptoms of having worms in stomach and how do they get there? So typically these worms are very small, they can be had in the form of eggs or as worms very rarely, particularly if children are eating mud, they are not washing their hands properly, if they are having food which is not properly washed and cooked, if they put other dirty things in the mouth, that is how children may develop worm infestation. Now, what are the symptoms of these worms in the stomach and intestine? The child may have poor appetite, the child may have iron deficiency anemia, the child may complain of stomach pains on and off, the child may have itching, particularly at the anal area, the area from which the child passes stools. That itching is more severe at night times, but there will be a general irritation. It is very rarely that you may actually see a worm in the stools of your child. So many parents, when we say give deworming medicine, they will say, but I have never seen worms. These worms may be very small and very microscopic for you to really visualize in the stools. Very rarely parents see some worms in the stools. Deworming, I don't recommend below 2 years of age to be done regularly unless there are symptoms in the child as mentioned above. Above 2 years, it can be done at an interval of 6 months if required. It is not compulsory to give the worms medicine every 6 months to children. There is nothing like that. But yes, if your child has habit of putting dirt in mouth, eating mud, or not washing hands, and frequently puts things in the mouth, then yes, every 6 months there is no harm in giving the worms medicine. The commonly used worms medicine is albendazole. It is given in 2 doses. One dose is given on day 1 and the second dose after 1 week or 2 weeks. Why is the second dose important is because the first dose will kill all the worms, but some eggs may be left behind. So the second dose takes care that even the eggs and complete eradication of the worms is done. So if you feel your child has any of these symptoms, you can consult your pediatrician for a deworming medication.